Hello everyone, today let's talk about mental health awareness. What is your mental health? Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps determine how we handle stress, relate to others and make choices. Mental health is important at every stage of life, from childhood and through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experience such as trauma or abuse, and lastly, family history of mental health problems. After the coronavirus outbreak hit the nationwide, there was a high increase in the mental health cases were recorded, especially in Malaysia. By 2022, mental health conditions are expected to be the second biggest health problem affecting nations after heart disease. A national survey by Ministry of Health found that 1 in 3 Malaysian adults aged 16 years and above, about 29.2%, have a mental health condition, which is nearly triple from 11.2% in 2006. The state of Sabah, Kelantan, Kuala Lumpur and Sarawak have the highest prevalence of mental health condition. Among Malaysian youths aged 13 to 17 years old, 1 in 5 have depression, 2 in 5 have anxiety, and 1 in 10 has a stress. And also, 10.1% of youth have also attempted to take their life.
I would explain about the types of mental health. First, anxiety disorder. People with anxiety disorders have excessive fear and related behavioral disturbances. The symptoms can worsen over time, interfering with their ability to function in their daily life. For an example, panic disorder and social anxiety disorder. Second, depressive disorder. Depressive disorder is a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life is not worth living. For an example, depression. Third, sleep-wake disorder. Sleep-wake disorder involves problems with the quality, timing, and amount of sleep, which result in daytime distress and impairment in functioning. For an example, narcolepsy and insomnia.
I'm going to tell you about symptoms of anxiety disorder, depressive disorder, and sleep-wake disorder. For anxiety disorder, the symptoms are apprehension, confusion, a sense of helplessness, repeated negative thoughts, muscle tension, palpitation, and difficulty of breathing. For depressive disorder, the symptoms are persistent sadness, loss of interest in activities, loss of appetite, feeling of worthlessness, becoming easily agitated, among others. Sleep-wake disorder, and the symptoms are difficulty falling or staying asleep, daytime fatigue, strong urge to take naps during the day, unusual breathing patterns, and last but not least, unintentional change to your sleep or wake schedule.
Next, management and treatment. Mental health condition cannot be cured by medication, but can be helped by doing some psychotherapy or counseling from doctors. Firstly, the medication for anxiety disorder. These include anti-anxiety medication such as benzodiazepine may decrease your anxiety, panic, and worry. Antidepressant can also help with anxiety disorder. It tweaks how your brain uses certain chemicals to improve mood and reduce stress. Beta blockers usually used for high blood pressure can help reduce some of the physical symptoms of anxiety disorders. They can relieve rapid heartbeat, shaking, and trembling. Next, the treatment for depression. Firstly, we can help by doing self-help. For example, regular exercise, getting enough sleep, and spending time with people you care about can improve depression symptoms. Medication. Prescription medicine called antidepressant can help change brain chemistry that cause depression. Alternative medicine. People with mild depression or ongoing symptoms can improve their well-being with complementary therapy. Therapy may include massage, acupuncture, hypnosis, and biofeedback. Furthermore, the treatment for sleep disorder. Treatment for sleep disorder can vary depending on the type and underlying cause. However, it generally includes a combination of medical treatment and lifestyle change. Medical treatment includes sleeping pill, melatonin supplement, breathing device or surgery that usually for sleep apnea, and a dental guard usually for teeth grinding. For lifestyle change, firstly, creating and sticking to a regular sleeping schedule, drinking less water before bedtime, limiting the caffeine intake, and lastly, exercising to reduce stress and anxiety.
Next, let's move on to the importance of mental health awareness. Mental health is equally as important as physical health. Although we often can see it with our bare eyes, a mental health problem can cause a serious damage to a person's life and well-being. One of the important is closing the gap. Colleges are supposed to help our younger generations prepare for the world that awaits and all the obstacles they might run into. Most colleges today only teach about physical health and nutrition. However, there's a gap when it comes to mental health. Without proper education, students won't know how to recognize the problem they are experiencing, open up about it, look for help, or help other peers with similar or other mental health problems. This gap actually needs to be closed, and the students need to have a chance of dealing with mental health problems just like they will deal with any other problem. The second one is suicide and mental illnesses. Suicide is one of the leading causes of death aged 10 to 25 worldwide. In addition, most of the people who have committed suicide have suffered from a mental illness. To lower the increasing suicide rates and prevent young people from taking their own lives away, we need to raise awareness about mental health in our college. Learning about mental health illnesses will leave a positive impact on the students struggling. They will learn about therapy and how to treat their problem. They will be more ready to talk about it. They will acknowledge that they have a problem. All of the above will hopefully lower the suicide rate and offer the young people a solution other than ending their life. Next is early intervention. Just like with any other disease or health problem, early interventions are important in mental health. Teachers, college counselors, college physiologists, and peers need to learn about detecting the early signs of mental health issues, spotting the meaningful changes in behavior, and acting at the first sign of a potential mental health problem. If the mental illness is in its early stage, there is a chance of stopping it from being fully blown. Everyone involved in a typical day of a person's experiencing mental health problem needs to be on board and help them deal with it. Last but not least is social media influence. While we love using social media to get informed, find entertainment, and connect with our friends, there is a dark side to it that not many people are talking about. The truth is, social media can leave consequences and deep scars in the minds of the users, especially the younger generations. Watching rich, famous, successful, and celebrity people on social media can cause mental health problems with young children such as low self-image, body issues, depression, and anxiety. Since social media is on its rise with nearly 3.5 billion active users worldwide, the effect it has on the young people around our school is mind-blowing. With this kind of a new threat, college need to raise the bar in the mental health awareness and ensure that students are learning about self-love, system of values, loving everyone, not judging people, and talking about their insecurities openly. In a nutshell, it is highly important to raise mental health awareness in college since young people are seriously affected by mental health issues every day. They need a system they can rely on and a source of information to guide them through the process of dealing with their inner issues. College need to initiate changes and get as many people, students, teachers, and other college employees to work on raising mental health awareness. Start with ourselves and initiate a change in our college today.